Hello, I'm Dr. Brad Williams. Today we are going to discuss the approach to the patient in early labor. Mrs. Smith will call you on the phone and tell you she believes she should leave home. While you listen, she presents her case. Her contractions previously were spaced, but now are coming 12 within an hour. And when they peak, her face is looking dour. Into a landy she now will head. It's the kind of phone call that you dread. At 2 am you leave your comfy bed. In place of sleep you know it's work instead. Now you could lie back down and fall asleep and wait for your drat pager to go beep. But with a second baby there's a chance. She might arrive in labor quite advanced. And there before you even don your pants, she will be delivered by Nurse Vance. So into the big hospital you drive. Eyes are squinty, feeling half alive. The elevator to the 8th your take. The smile you give the Smiths is very fake. But young doctors, let me make this clear. 9/10 of a landy is being there. Once arrived the patient you assess. It's tempting to take shortcuts, I confess. But doing so can leave you quite a mess. 'Tis better to do more instead of less. First, peruse the record, look to see that there is an exacting EDC prenatally. Were there complications? Medical conditions, exacerbations, laboratory tests and ultrasounds. Group B strep cultures must be found. Armed with information from the chart, you now can listen to the lungs and heart without the fear that the Smiths will mention a problem that requires your attention, about which you know not a thing at all. You stammer and you blush and hem and haw. Too late to now go running for the chart which you should have studied from the start. As the physical exam unfolds, including those maneuvers, Leopold, try to be as thorough as you can. Instead of a derisory exam, reflexes, blood pressure and edema. Is that gestationis or eczema? Are there lesions on the perineum? If you don't look, you'll surely never see them. While rushing to check cervical dilation, effacement, presentation and the station. If the presenting part you cannot reach, make certain it's a vertex, not a breach. In fact, even when the head is quickly found, there's information gleaned from ultrasound. Although an extra penny you won't earn by doing scans, this is how we learn. With Mrs. Smith in labor that is active, accompanied by a tracing that's reactive. Now the nurse will do you a great favor, watching like a hawk while Miss Smith labors. You must stay close and always heed her call. 'Tis no low risk in labor, none at all. The uterus can rupture, cords can fall. Blood pressure can rise, watch for it all. Expect the unexpected, be prepared, lest the night turn into a nightmare.